Yes, I hope both of you are ready. Once you've read this, there are, I think, 2 more slides. So 1 more slide. So if you can, once you've read this, please tell me, I'll move on.
Okay.
And you already know in exam, you'll be given 9 minutes in the bay to prepare for this station before you'll go in the next room.
Yes. And I have to write down this data.
You would have to prepare yourself, yes.
Yes, okay. Okay.
Yes.
Okay.
Okay. So if you have read and understood, considering it communication skill station, kindly please begin.
Hello, I'm the SHO working for Mr. X. I'm calling to speak to Dr. X, the cardiothoracic consultant. Came about the acceptance of a referral of a polytraumatized patient who presented with a widening mediastinum on X-ray. Can I confirm that I'm speaking to Mr. X?
Yes, carry on. How can I help you?
Today,
Summarize your case.
okay, okay, Mr. X. Today we have Mr. Y, who is 28 years old, who is presenting to our A&E department with a motorcycle road traffic accident. On examination, patient GCS is 14. Patient is tachycardic on 120 beat per minute. Patient is hypotensive on 100 over 80, and patient also have a swollen left side. We had withdrawn some bloods, which revealed his hemoglobin is 8.9, and pH shows acidosis and low bicarbonates. And also, it is known that the patient is diabetic. We also had made some imaging, which shows widening mediastinum and hemothorax on the chest X-ray, for which we inserted a chest tube, which drains a 200 cc blood. Also, we have done abdominal erect X-ray, which showed an absent psoas shadow. We have also ordered a femur X-ray, which shows a fracture of the femur. For this, we started a fluid resuscitation, about 4 liters of crystalloid. We have also considered matching for 6 units, but we have not yet given it to the patient.
Okay, and how is the cervical spine of this patient?
Actually, once the patient presented to our department, we supported it using a neck collar together with sandbags and tape.
Okay, are you sure the patient has him? Had this stuff?
Okay. I'm not sure. Let me revise my data.
Okay, and
actually, it's not written in the data, not written in data, but I'm sure I will follow it, and I will support his cervical spine by the options I told you.
Okay. So, and what you're going to do for the leg, broken leg?
Yes, I will splint the broken leg with atom splint.
Okay, and remind me with the blood pressure again. You said the patient is hypotensive.
Yes, the patient is hypotensive, about 100 over 80, and for which we started a fluid resuscitation with a crystalloid, about 4 liters of crystalloid, and also we have considered cross-matching of 6 units of blood, but we don't want his blood pressure to be to be high for fear of bleeding and hemorrhagic shock.
Okay. So you mentioned that earlier the patient has got a metabolic acidosis. Is that right?
Yes, yes, it's right.
What do you consider that?
The patient has a closed fracture in his thigh, in his femur. So a compartment syndrome might be a compartment syndrome might be a cause, and also the patient has an absent psoas shadow, which indicates the presence of hematoma, and hemorrhagic shock might occur. And also the patient is known to be diabetic, so diabetic ketoacidosis might be the cause.
Okay. What you going to do about the abdomen?
Okay, for the abdomen, we have already done an abdominal X-ray, which revealed absence of shadow. And for this, there might be a retroperitoneal hematoma, and it might be treated conservatively if the patient is hemodynamically stable. But if it is unstable, he might need a laparotomy and urgent intervention.
Okay. So do you want me to come and see the patient, or what the purpose of your
No. Actually, the purpose of my call is I want to refer this case in your kind care, please.
Okay. And who are you going to accompany this
Yes,
case?
I will accompany this case together with one of the anesthetists or one of the intensive therapy unit colleagues also.
All right. No problem. Can you summarize just what we've
Yes.
been through?
Yes, in summarization of what we have been through, we have a male patient who presented to our emergency department with a widening mediastinum and hemothorax. He suspected he's a polytraumatized patient and suspected the need of a cardiothoracic intervention. The patient has the signs of hemorrhagic shock. He is tachypnic, hypotensive, and also the patient has fracture in his femur, for which I will do Thomas splint for it. The patient is in need for CT, but our device is in service, and I also will check for the C spine, and I will splint it via a rigid semi-rigid neck cooler with sandbags and tape. And in order for the sake of the patient, I need to I will transfer this patient with the widening mediastinum for your care, and I will follow the patient. I will be with the patient together with anesthetist and one of ITU colleague. Together, I will continue the resuscitation with fluid and the blood while we are coming to you.
Thank you so much, doctor.
You still have 1 minute left. In what kind of ambulance would you send your patient?
I might I need an ambulance which has a monitor and also a CPR, a cardiopulmonary resuscitation device, and also to have a device to transfer crystalloid and if needed blood to the patient. So it might be well equipped for this situation.
Okay. Have you already discussed why patient is having metabolic acidosis?
Yes.
Okay. And have you already discussed why would you not manage the blood pressure quickly or all of a sudden?
Yes, for not letting the blood pressure to rise suddenly because of the fear of increased hemorrhage as the patient has absent psoas shadow and suspected retroperitoneal hematoma.
Very good. All right. Who would you inform about the patient trauma or?
Okay, I might inform my surgical consultant and also the consultant and the anesthesia consultant and the ITU consultant in my hospital.
In the trauma team. Good.
And also an orthopedic consultant with a vascular consultant for the fear of any vascular injury with the closed fracture.
Good. Would you inform? Okay, yes. Plastic surgeon?
The patient already has a closed fracture
Yes.
So he might not need a plastic surgery for his.
Yes.
Yes.
Good. Great.